A quick review: the pharmacology of the anti-diabetic drugs. So we have seen that we have different factors. They will be leading to an increase in blood glucose and producing hyperglycemia. Now I'm going to talk about a specific group of drugs. These drugs, they are going to mimic the incretin effect or to prolong its action or to prolong the action of incretin. Now let's see what is the incretin effect. Here I'm drawing a curve for the time and for the concentration of insulin in the plasma. Now if we give a glucose orally, so this will be the curve for the insulin concentration over the time. If we give the same dose of glucose IV, this will be the curve for the concentration of insulin over the time. So you can realize that giving the glucose orally will produce more insulin, and more insulin in the plasma will be, comparing if you give the same dose of glucose and IV, which means that the oral glucose is going to stimulate the release of some substances, the incretin, that will be increasing the release of insulin. And by increasing the release of insulin, you are going now to block all of these factors that will be leading to hyperglycemia, and finally you have a decreasing in the concentration of the glucose in the blood. So now here we have the small intestine. In their brush border, we have the absorption of the glucose which had been taken orally. Now the glucose will be stimulating the release of metabolic hormones. That's the one we call it incretins. Mainly here we have these metabolic hormones. We have the glucose dependent insulinotropic peptide, GIP, and also we have the glucagon-like peptide 1, GLP-1. Now specifically for GLP-1 is going to act on the alpha cells in the pancreas to decrease the release of glucagon. And if you decrease the release of glucagon, that will be leading to a decrease in the glucose production in the liver. Also, that GLP-1 is going to affect the beta cells in the pancreas to increase the production and release of insulin. And if you increase the insulin, is going to increase the glucose uptake in the fat and muscle, because you are increasing the insulin sensitivity. Also, the GLP-1, more specifically, will be decreasing the gastric emptying. So now the food will be staying for a longer time in the stomach. Beside that, is going to affecting the brain to decrease the appetite. So doing all of that will be enabling now the patient to consume less food and producing more insulin. Now these two hormones, they are going to be inactivates very rapidly in few minutes through a dipeptidyl peptidase 4. So this dipeptidyl peptidase 4 is going to deactivate these two hormones. So now the medications that we are going to use it to treat the hyperglycemia is either one of these. Either we have glucagon-like peptide 1 receptor agonist working as a GLP-1 exactly, or to block the activity of the dipeptidyl peptidase 4. So we have dipeptidyl peptidase 4 inhibitors. So the first group, the glucagon-like peptide 1 receptor agonist, as you can see here, we have 3 of them will be given daily, and 2 of them should be given once every week. All their names will be ending with tide, which probably coming from the peptide. So we have exenatide, that will be producing weight loss. Liraglutide also will be producing weight loss. And again, we have 3 of them, as you can see, it will be supposed to be given daily, and 2 of them, dulaglutide, will be given weekly, and semaglutide will be given weekly. 2 of them will be given weekly. Now, all these glucagon-like peptide 1 receptor agonists, their effect is dependent on the glucose to release the amount of insulin, and they are given by an injection as insulin. We give it a subcutaneous injection. Now, almost all of them, it might be leading to nausea, and also they might be increasing the risk for pancreatitis. The second group, the dipeptidyl peptidase 4 inhibitors, as you can see, all their name will be ending with gliptin. We have saxagliptin will be leading to heart failure, and we have allogliptin, it may lead to hepatic failure. All these medication, again, as you can see it, supposed to be given daily, and all of them, they are given orally. The side effects for the dipeptidyl peptidase 4 inhibitors, which will be ending their name with gliptin, it will be infections, headaches, and pancreatitis, and may also increase or produce a hypersensitivity reaction.